Yoga for Pregnancy and Prenatal Care. This course focuses on gentle, modified poses and breathwork, tailored to the changing needs of each trimester. In this guide, we will explore safe yoga practices during pregnancy and provide prenatal yoga sequences suitable for the trimester and to support the health and well-being of both mother and child. Tadasana. Be cautious if you have high blood pressure or balance issue. Use wall for the support. Avoid if you have recent or severe back or shoulder injuries. Stand with hip width apart. Inhale, raise your arms over your head, palms together. Lengthen your spine, engage your core, and root down your feet. Gaze forward. Keep your neck relaxed. Maintain steady and even breaths. Be here for few more deep breaths. Tadasana improves posture and alignment. It strengthens legs, back, and core. Enhances lung capacity. It promotes a sense of grounding and balance. Ensure that your arms don't overextend. Keep them close to your ears without straining. Exhale and slowly relax your arms down. Release the pose. Pre-pose. Avoid if you have ankle or knee injury. If you have difficulty in balancing, practice near the wall or use props for the support. Begin in a mountain pose. Shift your weight on your left foot. Lift your right foot and place your sole against your inner thigh or your calf, toes pointing downward. Avoid placing your foot directly on the knee joint. Engage your core for stability. Find a focal point to help with your balance. Bring your hands to your heart center in a prayer position, or you can raise your arms over your head, palms touching. Be here for a few more deep breaths. Inhale and exhale deeply. It enhances the balance and focus. It strengthens the leg muscles, especially the glutes. Improves posture and alignment. Exhale, place your right foot on the floor, releasing your arms down in Tadasana or mountain pose. Continue with other side. Shift your weight onto your right foot, lifting your left foot and place the sole against your inner thigh or the calf, toes pointing down. Avoid placing your foot directly on the knee. Engage your core. Find the focal point to help with balance. Bring your hands to your heart, or you can raise your arms up over your head, palms touching. Be here for a few more deep breaths. Posture also improves a sense of grounding and calm. Be mindful of your foot placement to avoid any undue pressure on the knee joint. Maintain your awareness of your alignment to prevent overarching of your lower back. Exhale, bring your foot down. Again, stand into Tadasana. Relax yourself. If you have any shoulder, neck or back injuries, perform this pose with caution under guidance or a qualified yoga instructor. Avoid overarching your lower back. Engage your core muscles to maintain a neutral spine. If you have high blood pressure, be mindful of how long to hold your arms over your head. Consider a variation where your hands are at the chest height. Begin in Tadasana, mountain pose, with your feet hip width apart and your arms by your side. Inhale, raise your arms over your head. extending them fully. Your palms can be either faced each other or touch over your head, fingers pointing upward. Engage your core muscles to maintain a stable and elongated spine. Gently press your hips forward without arching your lower back. Ensure your weight is evenly distributed on both feet. Hold the pose for a few more deep breaths, maintaining a strong and extendable posture. Be here for a few more deep breaths. This pose stretches the entire body, promoting flexibility and strength. It improves posture and helps to open the chest, enhancing the lung capacity. This pose can be energizing. It stimulates abdominal organs and aids to digestion. Exhale. Slowly lower your arms by your side and release the pose. Cat and cow pose. Avoid if you have recent back or neck injury. Modify the intensity of the stretch if you are experiencing any discomfort. Start in a tabletop position with your wrist under your shoulders and your knees under your hips. Inhale, arching your back, cow pose, lifting your tailbone and your head. Exhale, rounding your back into cat pose, tucking your chin towards your chest. Flow between these two poses, syncing with your breath with movement. Keep a steady and controlled pace. Inhale and exhale. Inhale, arching your back in cow pose, and exhale, rounding your back, tucking your tailbone into cat pose. Do this for a few more breaths, inhaling and exhaling. It promotes spinal flexibility, releases tension in your back and neck, massages and stimulates abdominal organs, enhance posture and core strength. Keep the movements gentle and do not force your spine beyond its natural range of motion. Continue and exhale, relax. Easy pose Sukhasana is generally considered as safe for most people. Those with severe knee or hip injuries or chronic pain may need to use a cushion or possibly opt for a different seated position. If you experience discomfort in the hips or lower back, consider sitting on a cushion or a folded blanket to elevate strain. Sit on the floor or a cushion with your legs extended in front of you. Cross your legs at their shins. Place your each foot beneath the opposite knee. Allow your hands to rest on your knees with your palms facing up or down. Lengthen your spine, keeping your back straight but not overly rigid. Gently tuck your chin aligned with the floor. Close your eyes and breathe naturally. You can also perform Gyan Mudra by touching the tip of the index finger and the tip of your thumb while keeping the other fingers extended. Be here for a few more deep breaths. This pose promotes a sense of calm and ease during the meditation or pranayama practice. It opens the hips and increases the flexibility in the pelvis and lower back. This asana helps to improve posture and spinal alignment. It can be practiced at any time, making accessible for the individuals of all fitness level. To release the Sukhasana, gently extend your legs and check them out if needed before moving on to other pose or activities. Child pose. Avoid if you have knee or ankle injuries. Use cushion under the forehead or your knees for comfort if needed. Begin in a kneeling position on the mat. Knees hip width apart, big toes touching. Sit back on your heels. Inhale, lengthen your spine. Exhale, hinge at your hips, lower your torso forward. Extend your arms forward alongside your body. Rest your forehead on the mat. Inhale and exhale deeply over here for a few more deep breaths. It gently stretches for the lower backs, hips, and thighs, relaxes the mind and relieves the stress, restores energy and calmness. If pregnant, open up your knees wider to accommodate the belly. Those who are with recent digestive issue or diarrhea should practice with caution. Inhale, come all the way up. Exhale and release the pose. Bhujanga Asana. Practice with caution if you have back injuries or herniated disc. Avoid pushing into pain. Avoid overextending. Focus on lifting the chest without straining the lower back. Pregnant individuals should practice with smaller lifts or explore prenatal yoga variations. Begin by lying on your mat with your legs extended. Place your palms flat on the mat beside your shoulders, fingers spread wide. Keep your legs closed, feet and toes pointing downward. Press the top of your feet on the mat. Inhale, engage your core, slowly lift your chest off the mat, keeping your pelvis and lower body grounded. Straighten your arm, lift your chest lighter. Avoid pushing too much your weight on your hands using your back muscles. Keep your neck neutral, looking forward or slightly upward. Inhale deeply through your nose and exhale slowly through your nose. Maintain steady and even breaths. Hold for a few more deep breaths over here. This pose strengthens back muscles, particularly the lower spine region. It improves your posture, flexibility in the spine, stretches the chest, shoulders, and abdomen. It stimulates abdominal organs, aiding to digestion. Relieves mild lower back pain. Slowly exhale and release the pose. Bring your chest down on the floor. Viparita Karni. If you have a serious eye conditions like glaucoma, avoid this pose. Be cautious if you have neck or back issues. Use props if you need. Sit with your side against a wall, legs extended along the floor. Swing your legs up to the wall while lying down. Keep your arms relaxed by your side. Or place your hands on your belly. Close your eyes, soften your gaze, and focus on your breath. Relax into the pose, allowing your legs supported by the wall. Inhale and exhale. Hold the pose for a few more breaths. It promotes relaxation and reduces the stress, enhances circulation in the legs and pelvis, relieves swelling in the feet and ankles. It calms your mind. If you are pregnant, ensure your hips are slightly elevated to avoid any pressure on your abdomen. Ease into pose slowly, avoiding overstretching. Exhale, bring your legs again down from the wall. Shavasana. Ensure your head, neck and spine are in neutral position and comfortable. If you have difficulty in lying flat, use props such as cushion under your knees. Lie on your back with your legs extended and arms relaxed at your side, palms facing up. Allow your feet to naturally fall open. Close your eyes. Take a slow and deep breaths. Let go all muscular tension, allowing your body to feel heavy and completely relaxed. Focus on each breath, releasing any remaining thoughts or worries. Savasana promotes deep relaxation and releases stress, enhances body awareness and mindfulness, improves sleep quality and overall well-being. Stay warm with a blanket or a shawl to prevent chill. If you fall asleep during Savasana, it is meant for deep relaxation. Deep breathing. This technique is to increase lung capacity and calm the mind and promotes relaxation. Find a quiet, comfortable space to sit or lie down. You can also practice deep breathing in a seated position such as Sukhasana. Place your one hand on your chest and other hand on your abdomen near your navel. Close your eyes, take a moment, become aware of your breath. Inhale slowly and deeply through your nose, allowing your breath to rise as you fill your lungs with air. As you inhale, focus on expanding your diaphragm and abdomen rather than your chest. Continue inhale until you feel a gentle fullness in your lungs and your abdomen has risen. Exhale slowly and completely through your mouth or nose. As you exhale, your abdomen should fall. Pay attention to the sensation of the breath as it flows in and out. Feel the rise and fall of your abdomen and the movement of your diaphragm. Continue with this deep and slow breathing for several breath cycles, maintaining a steady and rhythmic pattern. Continue. Deep breathing allows you to use your entire lung capacity, improving oxygen and respiratory efficiency. This practice activates the nervous system, promoting a state of calm and relaxation. Deep breathing is an effective stress management technique helping to reduce anxiety and tension. It enhances mental clarity and concentration by providing more oxygen to the brain. Slowly return to your normal breathing and relax. Body scan meditation is a valuable practice for relieving stress and grounding yourself in the present moment. Can be especially helpful when you are dealing with physical tension, anxiety, or as a part of a bedtime routine to prepare for a restful sleep. Choose a quiet and comfortable place to sit or lie down. You can use a yoga mat, cushion, or a blanket to support your body. Close your eyes and find a comfortable and relaxed position. If you are lying down, keep your legs slightly apart and your arms by your side. If you are sitting, sit with your back straight and your hands resting on your lap. Start by taking a few deep breaths to center yourself and calm your mind. Inhale slowly through your nose and exhale gently through your mouth. Begin your attention to your head. Visualize a warm, soothing light moving over your scalp, your forehead, eyes, and cheeks. Imagine this light is relaxing and releasing any tension in these areas. Slowly move your attention down to your neck, shoulders, and upper back. Feel the tension melt away with each breath. Scan your body, focusing your arms, chest, and abdomen. Feel the sensation in each area without judgment. Move your attention from your lower back, hips, and pelvis. Visualize any tension or discomfort. Direct your awareness to your thighs, knees, your calves, and ankles. Allow the soothing light to work its way down, releasing any tightness. Finally, pay attention to your toes and your feet. Sense the contact between your feet and the ground or your mat. Feel grounded and at ease. After you have scanned your entire body, take a few more moments to feel the sensation of your entire body at once. Breathe deeply and relax into the sense of wholeness. When you are ready, bring your awareness back to your breath. Take a few deep breaths, and when you are ready, open your eyes.